you know me well. Dr. Yo, Dr. Sadju, thanks for having me here. It's good to be back. It's nice to see the place changed and developed so much. It looks outstanding. And thanks for the opportunity to do this lecture series and giving me the chance to share some of the work we do at the Gold Coast. I think even though I was at the biomechanics, and this is a highly biomechanical subject, it's not limited for biomechanics, and I hope there are people around in this room that, for example, work with biomechanics or are interested in biomechanics approach, because I think it will be interesting for them as well. So hope you find this talk interesting. What we do, as Yalini mentioned, is at the Gold Coast we make musculoskeletal models and finite element models of soft tissue, and I think the best way to try to explain what that is to give you an example. And the best example I can give is from a project I'm deeply involved with, which is my PhD. So the first part of this talk will be very much about the outline of musculoskeletal modeling and finite element analysis. And then in the second part, we'll go deeper into details of musculoskeletal modeling, but also how our approach is at calculating tissue strain at the hip, knee, and at the ankle. So I'm just going to stand here. So my PhD is on generating patient-specific musculoskeletal models of patients with femoral acetabular impingement syndrome. I'll explain what that is later. The design of the study is a randomized clinical trial where you have one group getting conservative treatment and one group getting arthroscopic surgery, and we generate these models of them before their treatment and after their treatment. With that, I'd like to acknowledge GCORE, the group I'm involved with at Griffith University, and the grant we received from the National Health Committee. Femoral acetabular impingement is an, let's say, intrusion of two structures. And in this case, that intrusion happens in the hip. It happens between the femoral head